Tnai National President Dr. Tnai Kumar highlighted that ongoing unrest in Manipur has reached threatening level, warning people's well-being at serious risk. She made the remarks at the third annual conference held today at Jubilee Hall of RIMS under the theme Promoting Mental Health Literacy, Nurses' Responsibilities. The conference, organized by Society of Psychiatric Nurses Manipur in collaboration with College of Nursing RIMS, was attended by National President of Trained Nurses Association of India (TNAI) Dr. Tnai Kumar, along with main dignitaries including President of the Society K.H. Ratna, Professor of Psychiatry RIMS Dr. R.K. Lenin Singh, Chief Medical Officer of Imphal East Dr. L. Indira, and College of Nursing RIMS Principal Professor A. Devjani. Speakers at the event highlighted the rising mental health challenges in Manipur, with Dr. Tnai Kumar stressing the need for early detection, timely intervention, community awareness, and stronger collaboration to make mental health care accessible and stigma-free. Addressing the gathering, Dr. R.K. Lenin noted that Manipur records the highest prevalence of mental illnesses, yet only 15 to 20% of those affected receive treatment due to stigma, low awareness, and limited resources. He emphasized critical responsibility of nurses in strengthening mental health literacy and building a compassionate care system. The dignitaries released the conference souvenir, followed by scientific sessions led by experts from RIMS and other institutions. Topics ranged from nurse-led mental health initiatives and interdisciplinary collaboration to technology-driven awareness and integrating mental health education into routine nursing practice. The conference highlighted pivotal role of nurses in enhancing mental health understanding, improving patient education, and advancing holistic mental health care in the state.
Society of Psychiatric Nurses of Manipur is also playing a pivotal role in educating and empowering the nurses and the community about the mental health issues and the importance of mental health literacy in the public and in the community. This conference is also a significant milestone, an opportunity where you can exchange ideas, share your thoughts, share your researches, and build capacity and inspire innovations in this area. Our mission should be that we have to ensure that no individual suffers in silence and every voice should be heard. And if we achieve that, we are achieving a lot in the mental status of the people.